Hello. Good morning, everybody. Good morning. Wow, what a special time that was. Um, I was reflecting on that. I was reflecting on Dick's comments about running the race, and that thing about running together. I was never a runner. That's not something that I've ever had the privilege of. But I've been on a lot of teams, and I know what it's like to have people with you in the race, with you working alongside. And I was thinking about that in the context of our gathering together here, that we work hard to pull this conference together for you to have a great experience, but I would be kidding you if I didn't tell you that I'm drawing a lot of energy out of this. For me personally, this is a time of just great encouragement to know that we try we really do. How do I want to put this? I know that you're running the race with me. I hope that you know that we want to run the race with you. So that's something that really matters to me. And one of those tangible things, I think about all of the opportunities that I've had to speak with leaders in our organizations around the world, and to realize how many things we have in common. Doesn't matter where we come from, we have some things in common. And some of those anxieties, like here's one of mine. This is one of my things. After I do a public talk, about 2 hours later, I get these voices that say, "Oh, you were a failure. That didn't go right. You really blew it on that," and all of those things. And I just kind of go into this slump afterwards. And I was talking, believe it or not, yeah, Henry's not sure what to make of that. And after I shared that with the CEO of one of our member organizations, and he said, "Oh, I'm the same way." He said, I give talks all the time, and then about 2 hours later, I just feel this incredible depression sink in. I thought, oh, okay, well, that's kind of good to know. And then realizing also, I'm not the only one who makes bad jokes. And when I get nervous, was that nervous laughter or was that agreement laughter? A little bit of both, my staff says. Thank you. So, those things that we do that are mistakes, and somehow we also have grace for each other. And that's one of those things as we run the race with each other that's very, very tangible. We have grace. We show grace. I show grace when somebody does something that's weird with me. I want to apologize when I do something that's weird for other people. And these are just the everyday things that come with leadership. It doesn't matter where we are. One of the things we get to do at CCIH is to celebrate when something's going really great. And I think many of you know that in the past, we've had the International Health Champions Award. And there are several recipients of that International Health Champions Award in this group right now. And maybe, I think about a year and a half ago, we started thinking about that, and it's really good to recognize individual contributions, but we were hearing a lot about teams and organizations that just as a team or as an organization, they pull together and do something exceptional. So we started talking with the board about revising our approach to doing awards. And that led us to what you heard about earlier this year, which was the launch of the 2023 Hope and Health Award. I'm going to invite Dr. Mwai Makoka, who's the program executive with the World Council of Churches and a CCIH board member, to actually come forward. And as Mwai, please come on up. As he comes up, Mwai has been part of a small committee on our board that took on redesigning the award, and we launched and completed a nomination process, which I think Mwai will explain to us. And so, Mwai, I think over to you. I think we have the things that we need to have here. Let me pull that up. That's what you need.
Okay, thank you.
Is that good? Okay, thanks.
So this year, CCH has revised our International Health Champion Award that honored individuals and launched a new award to honor a faith-based organization, team, or project that has made significant, innovative, noteworthy contributions to the field of international health and to advancing Christian Love in Action. The process of revising the award was iterative, with contributions from both the CCIH board and CCIH members through a task force. We sought to ensure a more comprehensive and objective awarding process that reflected the collaborative nature of work in the faith-based space. This new group award recognizes that achievements in health are never the result of only one person, and that inspiration can come from promising innovations as well as success. The award is connected to the conference theme for that particular year. As such, the 2023 award is focused on hope in health, consistent with the 2023 conference theme. Now look at the selection process. Okay, so we received 10 nominations between February 10 and 28. A final list of 4 nominees was shortlisted and reviewed by a subcommittee of the board against the following award criteria. Number 1, demonstrating commitment to using their skills, knowledge, and available resources to serve the healthcare needs of vulnerable populations across the globe. Number 2, excelling at hope, humility, and/or perseverance. Number 3, achieving impact for health and wholeness from a Christian perspective. Number 4, collective role as leaders, visionaries, and role models for Christians working in international health. And finally, the team or project or group should have a recognizable connection to CCIH or a member organization. So now we announce the winner. We would like to recognize this organization for their efforts to address a rare and neglected tropical disease. Their critical role as a pioneering leprosy institution in India and likely across the world, and their perseverance in a challenging context where Christian persecution is on the rise. Join me now to congratulate Schieffelin Institute of Health, Research and Leprosy Center, Kargiri, India, for receiving the CCIH International Hope in Health Award.
Dear members of the Christian Connections for International Health and all those at this gathering, it gives me great pleasure to accept the Hope in Health Award 2023 on behalf of Schieffelin Institute of Health Research and Leprosy Center, Karigiri. It really is encouraging for us to be appreciated for the work we did during the pandemic. We were privileged for the opportunities we had to serve during this pandemic. Many of our patients could not access treatment during this time, and many were admitted in our hospital could not travel back to their homes on being discharged because of the travel restrictions. We had not only to provide outpatient and inpatient care during this time, but also provide food and shelter for those stranded during this trying period. Patients whom we had served could not pay for their services because of setbacks to their businesses. We were going through a difficult financial situation because of the fall in the number of patients, but our staff continued to serve despite cuts in salaries. Our hospital, at the request of the local government, provided beds for people suspected of COVID and also those suffering from COVID infection in special isolation wards. The American Leprosy Missions helped us by part funding our running costs to help ameliorate the situation. Many of our patients could not access not only their medicines, but also their regular groceries and food and fuel. I would like to acknowledge the help of local NGOs like YWCA and Rising Star and Development Associates International, DAI, who funded the groceries. Our staff went to the homes of people affected by leprosy and living in poverty to distribute their medicines and groceries despite the travel restrictions. In this, we were helped by the local police force. Our staff were very enterprising and fearless during the period of the pandemic. This recognition will be a great encouragement for them. We thank God for this opportunity to serve. We thank the American Leprosy Missions for nominating us for the award and the CCIH for this recognition. Thank you, one and all.
We are glad we have a representative from Schieffelin Institute, Valsa Augustine. She will receive the award in person.
Dear CCIH, Doug, Director, and staff, I'm happy and humbled to receive this very special award on behalf of our Director, Dr. Jerry Joshua, whom you just heard, all my colleagues at Karigri, and our patients at Schieffelin Hospital. This really comes as an affirmation and reminder of our theme that our labor is not in vain. It is an honor for me to receive this award. We hope that this will further inspire us to continue to provide quality care to persons affected by leprosy, and also continue as a center of excellence in training, research, and rehabilitation. Thank you, ALM, for nominating us. And thank you, CCIH, again, for all your recognition of our services to leprosy affected. Thank you all.